Okay. Good morning, everyone. I'm Nancy White. I'm the Education Chair for the San Diego County Breastfeeding Coalition, and I want to welcome you to the fifth of our 6 World Breastfeeding Week, National Breastfeeding Month seminars. And the dogs you hear behind this are mine. Sorry about that. Due to COVID-19, we can't have our usual large World Breastfeeding Week in-person seminar, so we're hoping you're enjoying these webinars that we've been putting on. We have one more to go next week, September 5th, which will be the human milk banking and human milk research, courtesy of UCSD, and we'll have some wonderful speakers. You can put your questions in a question and answer box, and we'll try our best to have our panel answer them. A link to an evaluation form and the recorded webinar will be available in a day or two, and your certificate of attendance will be emailed to you. As you're aware, the theme for 2020 World Breastfeeding Week is Support Breastfeeding for a Healthier Planet. And I hope we all get and remain healthy and our planet does the same. This week we're celebrating Black Breastfeeding Week, whose theme is Revive, Restore, and Reclaim. I think that rings true for all of us. According to the Merriam-Webster Dictionary, equity is defined as justice according to the natural law or right, specifically freedom from bias or favoritism. We all have conscious and unconscious biases. Learning how to recognize them is not always easy. Learning how to deal with them is essential if we're to have a just and equitable society and a healthcare system that is just and equitable as well. Our 3 speakers, Mary Grant, Jara Foster, and Nikki Helms, have much to teach us. They will introduce themselves and their work and speak briefly. Then we will open the floor for the entire panel to have written questions from our participants, which are you. And if you have questions, please put them in the question and answer box, and we'll do our best. Our speakers you can see on the side of your screen, and Mary Grant is a public health nurse for the County of San Diego Black Infant Health Program. Jara is an MBA as well as an IBCLC, and Nikki is a midwife, labor and delivery and postpartum doula, and they'll introduce more details about themselves. So I'm going to turn it over. Just let you know that Maricela Chavez is the administrative coordinator for the San Diego County Breastfeeding Coalition, and she's going to be our moderator today. So you'll see her as well.
Good morning.
Say hi, everybody.
Good morning. Happy Black Breastfeeding Week, everyone.
Good morning.
Okay.
Morning.
So, Mary, I'd like you to go ahead and share your screen.
Yes. Let me pull that up here. So I do have a PowerPoint. If everyone can see that okay.
Perfect.
Yes. So my name is Mary Grant. I'm a San Diego County public health nurse, and I was asked to speak on the county's Black Infant Health Program and the Perinatal Equity Initiative. So just some history. I don't have any conflicts of interest to disclose. The San Diego County, or the Black Infant Health Program, actually is funded through the California Department of Public Health and was established to address health disparities amongst pregnant African American women and infants. San Diego implemented their program in 1992. So it is a county administered program. However, the contract is held by Neighborhood House Association, so they provide a lot of the direct services, client services. And I came to the program about 3 years ago. I actually was a cardiac nurse working in a hospital and somehow made my way to public health. And I knew nothing about maternal child health until I got to the program. And I have to say, the NHA Black Infant Health staff, they've Some of them have been with the program for many years. If it wasn't for them, I wouldn't know a lot of the information that I'm going to show you in the following slides. So I just wanted to acknowledge and recognize them. So what health disparities is the Black If Health Program and Perinatal Equity Initiative trying to address? So unfortunately, for instance, in San Diego County, African-American infants are nearly twice as likely to die during their first year of life, over 1.5 times more likely to be born with low birth weight, and nearly 1.5 times more likely to be born premature. So this is more of a visual representation of kind of what I was just telling you. As you can see, white, Hispanic, Asian women, their lines are down here, and white women are 2.8. That's the rate for infant mortality in San Diego. And then this gray line here is actually the Healthy People 2020 goal. So you can see all these other races are meeting or exceeding that goal, and African American women are here at 9.0. So that's the rate African American infants are dying at in first year of life. And you can see this huge gap here between African American infants and infants of other races. And that's really what we're trying to address. Why do we have these disparities between African American infants and infants of other races? So the other thing I did want to show you is breastfeeding rates. So actually, if you could see here, there really isn't a disparity between the intention to breastfeed between African Americans and whites in San Diego County. And I can tell you that's definitely been my experience in the program. A lot of women, very few women I've met don't want to breastfeed. So a lot of them intend on breastfeeding. Unfortunately, there's some challenges, which I'm going to mention later why I think that is. Challenges that end up leading to lower rates of breastfeeding among African American women. So why do we have these disparities? Because all African American women, regardless of their age, income, or college education, so what should be protective factors for women of other races and are protective factors are not for African American women. They still have poor birth outcomes regardless of how much money they make, what their education is. They're also 4 times more likely to die of maternal complications when compared to white mothers. So why is that? Why are African American women, all African American women, experiencing these birth outcomes? So the reason for that pretty much is the history of racism in this country and structural racism that continues to persist to this day. That's leading to, or it's manifesting itself as toxic stress for African American women. Chronic long-term stress can definitely have an impact on your health. You got cortisol pouring into your body, and that cortisol can increase your heart rate, increase your blood pressure, lead to slower metabolism. So that all can weather your body age you, and leads to unhealthier pregnancies, which is why African American women are having higher rates of premature births, higher rates of low birth weight babies, and more complications, both during their pregnancy and postpartum. So this is also to show the social determinants of health and how that affects infant mortality. So depending on your socioeconomic class, your race, that can lead to you're experiencing institutional biases and inequities that can affect your access to quality housing, access to good health care, education, which can lead to maybe some higher risk behaviors. Although I want to stress that the reason African American women are suffering from these disparities is not necessarily because of lifestyle. It's because, like I said, these the structural racism that ends up affecting their health downstream. And that's kind of what this is supposed to represent, just how structural racism affects health. So what is the program doing, or Black in Health program doing, to address these disparities? So I'm not going to spend too much time on this slide, but really we work with pregnant African American women and postpartum African American women. Now we have a group model that we use. That's the most innovative, I think, most effective part of our program. We just added on a case management model. So that's why I was saying we are taking more women that are postpartum now. The group model requires more of like a tighter eligibility, because we want to make sure that women are attending enough groups to have an impact on their birth outcomes. And I'll kind of explain more about the groups in just a bit. So what we're trying to address in our program, especially through the groups, is trying to help women with stress reduction, social support, bonding, and empowerment. You can feel pretty powerless if you're experiencing racism. It's out of your control, but you're trying to give women power and empower them when it comes to the decisions that they make for themselves and for their children. So that's kind of what we're trying to do in the program, and we do that through group. I'm not going to talk about everything here. So I do want to mention we have the prenatal and postpartum groups that the women do join. So it's for 10 weeks. Both the prenatal groups are 10 weeks, postpartum groups are 10 weeks, 2.5 hours, usually 1 day a week. And we talk about different things such as stress and racism. We talk about getting your needs met. We do a lot of health promotion. So we talk about safe sleep. And of course, we talk about breastfeeding rates. And I did want to mention also all those things, the disparities that I mentioned and how they affect breastfeeding. If you have women who are having premature babies, low birth weight babies, those babies are going to end up in the NICU probably. And that's another challenge that women have to overcome. That's more stress, of course. We know what stress does to milk supply, and less time at the breast. There's going to be difficulties with latching. So it's no wonder, because of the disparities that African American women are experiencing, even the postpartum complications. I just had a woman a couple of weeks ago who, in the middle of trying to figure out how to breastfeed her baby, she's having a lot of breastfeeding challenges. In the middle of this, she had to be hospitalized for a postpartum complication. So all those things I mentioned about the premature birth rates and maternal complications, that affects breastfeeding rates, definitely. And that's why I think a lot of African American women start off wanting to breastfeed and then end up, the reality is that it's difficult for them. So anyway, in the groups, we do a lot of health promotion. Breastfeeding promotion is one of them. They're not classes, so we don't teach breastfeeding, but we're just trying to get women to think about, is this something they want to do? They kind of get together and talk about what they think the benefits and the challenges are, so that's a decision that they can make amongst each other, and in a way for them to positively influence each other as well. We don't, they're not all necessarily first-time moms, but we have like a mixture of first-time moms, some moms that have breastfed before, so it's nice to get them together and bond, and they have more of a positive influence on each other and their health. So that's why I just wanted to talk mostly, we do other services and everything, I just wanted to talk mostly about the group and how we're trying to address breastfeeding. Also, I guess San Diego Breastfeeding Center had, I think there was a grant that they were able to provide. Jira, she was able to work with our participants. So anybody that had breastfeeding challenges, we referred to her. So she was invaluable. So I just want to say thank you, Jira. We had a lot of good feedback from the women because of your help. So that's one other thing that we do. The other thing is we were able to have some of the staff take lactation educator classes so that we could actually teach a breastfeeding class. And we've been doing that since December, like about 5 of the staff became lactation educators. So we do have a class. It's extra, it's not a required part of the program, but it's just something that women can do, because we did get a lot of requests from women to have classes. So those are some of the things we do within the program. And then here's some of our outcomes. I'm pretty proud of this. Breastfeeding initiation is on average about 90–89%. So, which is a little bit better than I think what you saw with the county. It was more, I think, at 72%. So this is our rate for the women in the San Diego County program. And our normal birth weight babies are about 83% on average. So yeah, that's the program. These are our outcomes for Black Infant Health. And I did want to talk about also the Perinatal Equity Initiative. That's something else that the county is doing. Governor Newsom has signed some legislation establishing the Perinatal Equity Initiative. So all the jurisdictions were given funding to try to address this issue of disparities. And a lot of it consisted of like community engagement meetings, community advisory board meetings for us to, I think Nikki Helms was there at some of those meetings. A lot of people from the county, like home visiting nurses, PCI, Project Concern International, Black of Health, like a lot of, just to name a few, a lot of different people, stakeholders, anybody was welcome to come and to talk about what we thought the gaps were in services, where we could put more funding behind. So there was a media campaign that came out of that. I don't know if anybody's seen, I haven't seen them, I don't go anywhere. So there's been a media campaign, there's some billboards up, I think one in National City, and there's a couple more around the county. And that came out of the discussions during the meetings. We also decided for our county in particular that we wanted to try to fund more fatherhood initiatives, so more fatherhood programs supporting fathers of either they are African American or fathers of or partners of African American women. So because we feel like some of these other interventions there's already a wealth of, so we felt like that may be a gap that we could try to help through PEI. And the other one was implicit bias intervention. I cannot tell you, like, I'm always surprised when I come across providers that think they don't have bias. If you're a human being, you have bias. And it's really this, hopefully this implicit bias training will be about addressing your biases and making sure they're in check and that they're not affecting your interactions or your care with your patients or your clients or whoever you're working with. So those are the two things that PEI decided that they will be funding. And yeah, so that's me, and that's the two programs that I work with at the county. And I thank the San Diego Breastfeeding Coalition for having me here as a speaker today. And I want to get to Jara and Nikki. I'm really honored to be part of the panel. So thank you, everyone.
Thank you, Mary. And if our audience does have questions, go ahead and type them in the chat while they're fresh. We'll get to them at the end. Right now, we're going to transition over to Jara Foster. Jara, thank you for joining us.
Hi, thanks for being here. Really kind of excited to be able to talk. I'm an IBCLC working here in San Diego. I own a private lactation business that I've partnered with the San Diego Breastfeeding Foundation to provide services to participants of the Black Infant Health Program, and also PCI, Project Concern International Healthy Start Program. I also work as a lactation consultant for Team Tongue Tie. Through both of those, it's kind of been an interesting position to be in. I get, my typical lactation home visits is what I do in private practice. But then I also kind of have had a really unique opportunity to specialize in, an area of lactation that oral restrictions. So for Team Tongue Tie, basically, I'm helping with breastfeeding after the procedure. So yeah, I've always had a passion for health and wellness. I came to lactation, later in my career. In 2016, I kind of just was done with my corporate career. I figured out, I'd have a baby in my 20s, and I'd switched to become a doula, and here I was 30 something and none of that had happened. So I think it was just time, and I said, well, things will come along as they do. And so I started off with, lactation educator training. I wanted to kind of help the maternal health of people that I was friends with. So I got a certification in health coaching from the Dr. Sears Wellness Institute, focused on like behavioral health change and in pregnant women. And then I also was interested in addressing some of the generational and transgenerational trauma. So I've been kind of working on a trauma training where it has its backgrounds in somatic experiencing. And then of course I got my IBCLC. And then this year, in May, I gave birth to my little baby girl. So now I'm kind of able to do a lot of practicing what I've been preaching. And it's just going to be great going forward once I kind of step really back into the workspace. So I have really enjoyed my work with Black Infant Health and Project Concern International. It's been so rewarding. I mean, I became a lactation consultant so that I could influence and help people in my community. I had family members who struggle with breastfeeding. I was breastfed partially, so I just wanted to really kind of extend my knowledge out, and I saw that there was such a lack of Black lactation consultants around in the US, specifically, obviously in San Diego. So, you know, I think the best thing is that, you know, when you walk into the house and you see the client, and there's just this understanding, you know, that I see them and they see me, and that there's this understanding kind of right off the bat, and I think that's really special. Some of the things that I've kind of noticed, and Mary kind of, I mean, she did a great job hitting on the overarching things that are challenging and are challenges to breastfeeding duration rates in the Black community. Those are things like, you know, your underlying health conditions, so gestational diabetes, the need to return to work. You know, it's so, that first 4 to 6 weeks, I mean, we always as lactation consultants talk about, oh, you know, the first 2 weeks are really important to establish milk supply. But for many, things continue to be a struggle. For me, things continue to be a struggle in the first like four weeks. And so without, you know, constant kind of contact, if you're having breastfeeding difficulties over that time, I think it's really hard to kind of persevere, really, because you just have so much going on internally, externally, and dealing with a new baby. So needing to return to work soon is going to be another factor that is going to influence what the breastfeeding plan is. You know, I've heard stories and seen moms, they're not knowing how to manage this family unit. So people coming to the house all the time. Oh, you know, my in-laws were coming, my mom was coming, my friend, auntie was coming, and I couldn't keep up with this schedule. So formula was easier to give, or I missed a pumping session. So my milk supply is not, you know, kind of being where it needs to be. I didn't have time. Of course, we have, you know, the issue of oral restrictions, which happen, and then how do we manage that given sometimes limited resources? That's a lot. And you're uncomfortable breastfeeding your baby, you know, that's going to be an issue as well. I've seen lots of bottles being introduced really early on. I think that we're not, or these moms are not hearing about paced bottle feeding. Every time we send somebody with a bottle, we have to talk about paced bottle feeding, because these babies are latching in the hospital, and then they're coming outpatient and they're coming home, and, you know, within 2 to 3 weeks, they don't want to go on the breast anymore. And that's pretty much because the flow, right? And we're not pacing, not pacing the feedings. And so that's kind of something that pops up a lot. And then, you know, and I think this is kind of from my experience being a lactation consultant, not having a baby, and now having a baby. I think we sometimes set unrealistic expectations, or we're very much focused on, if you're going to have enough milk, don't worry about that. You're going to have enough milk and it's going to be great. And it's, you know, just don't worry about it. Don't worry about it. And it sets this expectation, I think, that, you know, if things aren't going right, then maybe there's something wrong with me, my milk supply, or my baby. And sometimes it's just, breastfeeding is hard, and it takes time to get things working right. And you have to learn where to put your baby in relationship to your breasts are different. They've changed, you know. I mean, I remember just the angle of me helping somebody versus me doing it on myself. You know, it's challenging. So, I think having some more realistic conversations about what breastfeeding looks like in that first month to 2 months. So yeah, there's a lot, but I think that it's just been great, and I for this work to continue, we just need more people like me. You know, we need more Black lactation consultants. I don't know, maybe I was seeing 3 to 5 patients a month, you know, so there's obviously the need, and we just need to kind of figure out how to get more of these out there.
Thank you, Jara, which is a perfect transition to our next speaker, Nikki Helms, midwife and lecturer. Nikki, can you tell us a little bit about your work and where you're seeing gaps and what you're doing?
Sure, happy to. I love that you said midwife and lecturer because I have children, so I lecture a lot. But what I do is I am a licensed midwife, so I work most of the time with families that are birthing outside of the hospital system. I work with families that are birthing at home. I work with families that were birthing that want to birth in birth centers. I'm currently in the process of fundraising and finding space for a birth center that I will be able to build and provide for the community, which I'm super excited about. And there are a lot of things that both Jara and Mary are doing or have done that I would like to see, make sure that it continues at the birth center. For instance, the fatherhood support models. I really, really want to make sure that fathers are supported, and it's not just, not like Mary said, it's not just Black fathers, it's just fathers in general. Pregnancy tends to be a lot about the mom, which of course, makes sense because it's all happening in there. So of course it makes sense that it's a lot about the mom. However, I don't want the fathers to depend on the moms to parse out information to them. I want them to feel empowered to get their own information, read your own book, come to me as the mother with some interesting, tidbits of information. So I'm really working on putting together a program that supports that. I am working also with Project Concern International, and I am helping to offer the Project Concern International Healthy Start clients, helping to provide them with midwifery care, in addition to the care that they're generally seeing through. Most of our clients go to UCSD because they all have Medi-Cal, and so um, oftentimes I find that when you have Medi-Cal, you're not necessarily directed the right way to the resources that are available to you. So I like to make sure that people are aware of the resources that are available. And I also, speak with, I teach the cultural competency class at the Najoni Institute of Midwifery, where I attended and graduated here in San Diego. Equity advocacy is something that I am just passionate about. It is something that I feel is just inherent to my existence, because I am in this world as a woman in this brown skin. I have to make sure that everybody is getting equal treatment, including myself, including my children, including, these families that are going to be birthing, in this day and age, not just in this day and age, because of course this is not something new, right? But in this day and age, it just seems to be just that much more important because, of where we're at as a society. So the birth center, hopefully the idea is that we will be able to provide the community with a lot of those resources. For instance, we would love to be able to, the idea is to have, several spaces that are available to practitioners at any given time. So, we could have Jara come in one day and give a class on breastfeeding. We could have, Mary and her team come in and do, some outreach from Black Infant Health. So really making sure that there is community involvement, because community involvement is what makes the postpartum period a bit more bearable. I do tell people all the time that, breastfeeding is important. You gotta eat, you gotta drink, you gotta do all these things, and you have to remember to ask for help when you need it. People we as women are just not socialized to do that. Not just women, but women of color. We are not socialized to be able to ask for help. So that's kind of a hard bit of a learning curve, in addition to the learning curve that Jara mentioned, which is, just breastfeeding in general. If you have, a body that you want to feed your baby with, there's challenges there just are. So, my hope is that we're able to really take that infant morbidity and mortality rate and make some changes from the jump, like from the very beginning. And I'm very happy to say that, you know, I have gotten several clients that have called me and basically said, I just peed on a stick like 5 minutes ago, now I need a midwife. Thank you. I'm happy to take care of you. Because, you know, it's one of the things that has been proven to be helpful to women of color, Black women in particular, is to have midwifery care, and to have midwifery care from midwives that look like them. And so, you know, much to Jara's point, we just need more me out here, you know, because to be perfectly honest, and I don't know how many people know this, but there's really only 4 Black midwives in San Diego County, the whole of San Diego County. So congratulations, you have just spoken with 25% of the Black midwives in San Diego County. So, you know, there's many, many more discussions to be had with regards to equity advocacy for funding for midwifery school, and, you know, finding training programs that Black women are able to attend and afford to attend, and, you know, things like that. It's just more of, you know, more of me needs to happen, and we need to figure out the best way to make that happen and to make that education accessible to Black women. So yeah, so that's me.
Thank you, Nikki.
Mm-hmm.
We do have some questions coming in from the audience. If you have any questions, go ahead and type them in the chat. We are going to start getting to the Q&A portion of our panel very soon. But I want to ask each of you, you know, you can go ahead and ask questions of each other too. It's really great to have you all together. But, you know, maybe you can tell us a little bit about your own experience as Black breastfeeding moms, and how being a professional in the field too, how you filter those two experiences together. Any thoughts on that?
I actually don't filter them separately. You know, it's impossible. So yeah, a lot of my help and assistance and guidance to moms who are breastfeeding comes from my own anecdotal experience. Especially the whole, like, you don't just always, it doesn't always work where you just pop a boob in and it works. That was my experience. You know, that's not the typical way that people learn. So, but I do tell people that, you know, I breastfed, I wanted to breastfeed for longer, but I also had the presence of mind to listen to my children. And when they were not about it anymore, I just stopped chasing them around with a boob. And I was just like, I'm gonna go sit down over here then. So, you know, it's all about knowing yourself, listening to your body, watching and listening to your children, and knowing that, you know, they're going to give you the signals, you know. And my mother breastfed me and my sister, so in our family that was just standard of practice. So I felt very fortunate when I did start to find out about the disparities that exist. I was very fortunate that breastfeeding was a norm in our family.
I think for me, because I got pregnant and had my baby while I was in the program, or the nurse for the program. And so I had a lot of, you know, classes on breastfeeding. I thought I knew what I was doing. And breastfeeding was really extraordinarily challenging, especially that first 2 weeks. I was so hard. And I think I had a better understanding of how difficult breastfeeding was for the women in our program because of the experience that I had. And I had a lot of education and knowledge, and it still was a challenge. So so I just, because of my experiences with breastfeeding, I have much better like empathy and understanding of the difficulties involved. So
yeah, and I as I mentioned before, you know, I had been practicing as an IBCLC for I don't know, a year and a half, maybe 2 years as a lactation consultant. So you know, my training and the work that I had done prior, I mean, I had seen many clients. I've been very fortunate to be busy. But, you know, I'm really excited now that I've gone through this process to share, you know, because there really isn't anything like trying and doing it. And I think there's an element of what I want to mention is basically sometimes we tend to have a little bit of complacency with this breastfeeding conversation. Like, some breast milk is fine, and it is, and it absolutely is. And I'm also one, as a lactation consultant, I'm like, you need to enjoy your baby. So like, if we're entering in the area of some struggles with mood and anxiety, we want to make sure mom's on board and the breastfeeding parents feeling confident. But I guess I see and I hear sometimes from the moms that there's this, oh, well, you could give some formula here and it's fine. And it's almost like, because you're Black. So I wonder if we're saying the same thing to mothers who are white or in other situations. And the other thing that I'll talk a little bit about is the family influence. As I said, I was breastfed, and my brothers, I have 2 brothers, they were breastfed. I also got some formula. But I'm a lactation consultant. My mom knows I'm a lactation consultant. And she still, when I was struggling, was like, oh, well, there's some formula and you want to get some formula. So the influence of the family unit and how, and especially in the Black family, how that support is there or not there, or how it shows up is something that can't be taken for granted. And you really have to understand that aspect. Yeah, I think it's going to be really nice that I'll be able to draw from my own experiences now as I'm helping these folks.
Thank you, Jera. We did have a question come in specifically for you. It says, are there any services for low-income families to access care specifically for babies with tongue tie and lip ties?
Yeah, that's a really good question. I actually want to start looking into this as I come back into work this probably next year, and start seeing if there's some grants out there, because that's been something that I haven't seen a lot of. I know that there's there's the outpatient providers, or sorry, private practice providers versus those covered by insurance. And so there's different tools folks are using. There's different follow-up of care. So I'm really interested in seeing if there's some grants that, can be found and utilized to help some of these families, because yes, I can help baby. I remember a mom, she was really struggling, and the nipple shield worked, and it was great with, and she was able to breastfeed. But, using the nipple shield, how long is this going to sustain for, right? And what do we do? It's something that bothers me a lot. And on that, I also say that even the other part of the breastfeeding circle, right? So like, we know it takes this village to breastfeed. So these other care providers, chiropractors, body workers, to help with latch and things like that. I have been restrained on being able to refer, or I know when I am referring the clients to other providers, they might not be able to afford it. And so there's just a disservice that we're doing by not having this access to other providers that could help extend these breastfeeding relationships. So I'm not aware, to answer the question directly, of any services for the oral restrictions. That goes from body work to the release providers.
The question came in and specifically addressed to Jara, but does anybody else have any information on any such funding or programs for families that are looking for services? Well, we've identified another gap, so hopefully that's something that we can work on addressing. We have another question that came in generally, and that is, does the county offer any services specifically for Black, non-binary, non-gender conforming, and trans community around body feeding? Or do other panelists know of any?
I wasn't in the program at this time. I was told that we did have a transgendered man who was pregnant and in the program. As far as like specific programs for non-binary, transgendered, like wanting to chest feed or body feed, I'm sad to say that I don't know of any services. But definitely if a transgender man or a non-binary person was pregnant and wanted to be part of our program, that would be one resource that we would have. And I probably would just refer them to all the different, breastfeeding or chest feeding resources that we already have for the women in our program currently. But specific to that, no, I don't know of any.
Do any of our other panelists?
I don't know of anything specifically for that particular group of folks. I do know that, for me, I have definitely taken a lot of additional classes that are specifically designed to support transgender birthing folks. So I'm definitely comfortable with working with folks who are transgender, gender non-binary in the birthing space. So I would definitely recommend that they reach out to a midwife prior to just like bopping over to the OB, because I'm pretty sure that transgender and non-binary folks are already aware of the biases that exist to their situation. So I'm pretty sure that they're probably already looking outside of the box, as it were. So I had the privilege and the opportunity to work with several gender non-binary folks that would have been birthing. I have, a great amount of respect for the amount of courage that takes. So yeah, I don't know if anything specifically, but I would definitely say to reach out to your local midwife.
Thanks, Nikki. Another question we had is, are there any funding opportunities to increase access for Black people in San Diego who are wanting to enter the professional fields of breastfeeding, support, and midwifery?
Funding opportunities don't really, I mean, they're coming. A lot of it depends, and I can only really speak to the midwifery piece of this. A lot of it depends on the generosity of the schools, right? The schools themselves have to provide the scholarship programs, but seem to be a lot of smaller scholarship programs that are popping up, here and there. Some organization will offer $1,000, some other organization will offer 500. So if you can cobble together enough of those, then yes, you can absolutely make it possible. However, I went to the school here in San Diego. I went to the Najoni Institute of Midwifery, and when I went to Najoni, I really found myself, I knew that I was paying for my tuition, but I knew also that I was in a situation that was very unique, that I had a husband that had a good job, and I was going to go to midwifery school, and we could afford for me to pay for that out of pocket. And so when I looked around and saw A, that I was the only Black person in the class, I started, and then B, the fact that everybody was paying, it was like, well, there's a problem here, and it feels strange, and I don't know what the strange problem was. And then I realized that our school didn't offer a scholarship for women of color, and I could not figure out why. There is a program out there called the Grand Challenge, and the Grand Challenge offers scholarships for midwifery school for women of color, but the scholarships also have to be provided or initiated by the school itself. So I marched down to the director's office and said, why don't we have a scholarship program for women of color? And I just looked at them, and they had nothing to say. And it's like, okay, so if you don't have a good reason why not, then you need to do something about this. And then I just walked out, and I thought to myself, wow, that was kind of ooh, who do I think I am? I'm just walking in here to band and stuff. But they did it. They did it. They found a way to do it. They did it. It was one of the blind spots. Like, they didn't even realize that it didn't exist, and it didn't dawn on them to take some responsibility in that. So, you know, my grandmother used to always say, closed mouth don't get fed. So you got to go and open your mouth and say what you need, and make sure that people are aware that they are being held accountable, you know, for coming up with the funding. So oftentimes too, it has to do with the fact that the school itself has to provide the federal government with some sort of information so that you can then use things like the GI Bill to go to midwifery school or to go into, you know, any sort of alternative education that's not like straight up college. So there are a few opportunities out there that I just keep finding. And if you are watching this webinar and you're interested, I have a group on Facebook called So You Want to Be a Midwife, and it's specifically directed to Black women and women of color who want to become midwives. And we are in that group talking about, here's this tiny little stipend, here's this tiny little grant, here's this tiny little scholarship. And, you know, these women are applying for these scholarships, and they're finding out about the schools, and they're finding preceptors and textbooks and things like that. So there's opportunities out there, and I'm hoping to try and aggregate those in that group so that everyone has access to the same information.
Thank you.
Um,
Jara, you mentioned you received a scholarship. Can you tell us a little bit about that?
So the San Diego Breastfeeding Foundation, San Diego Breastfeeding Center, they have a foundation. Their foundation is definitely helping to get more Black lactation consultants educated. And so they have a donation every year, I mean, a fundraiser every year, but that's kind of how I'm able to provide services to Black infant health and PCI. So, you know, I think that just recently, you know, they were doing a big fundraiser for breastfeeding month. So that's a really good source, and that's local to San Diego. I know that I've seen some, I'm trying to think what else. There is For the Village, which is an organization that's providing doula services and to the community, definitely focused on underserved communities. And so they are another really good place to contribute resources, trying to train other doulas. And I guess I take a second to talk about this. So, you know, I utilized, Nikki was one of my midwives. I had another awesome midwife, Darrenay, and it was amazing. And it was amazing because I had folks in the room who had gone through this process. And it's like that, and we talk about this ancestral DNA. And I think that as I think sometimes we can take for granted things that are just commonplace. So I have mostly had white providers, mostly white healthcare providers, and they have been awesome. And I knew that when I gave birth to my baby, I really wanted to have all the things that I could do to ensure a good outcome, that I didn't become one of the statistics, the poor outcomes. And I guess there's just, when your healthcare team looks like you, there is just this deep understanding that they have your back, that they've been there before, and that you're going to be okay. And you don't realize that when you've not had that experience. But when you have it, it's like, oh my goodness, this is what care looks like. This is what care should be. And so I think it's super important. It's not just that, you know, oh, they're Black and they've had the same experience, because no, there's many Black experiences, right? Some of them, of course, are the same, like we've, you know, experienced this systemic racism and all these things, but it's also that, you know, these women and these people that came before you, they know there's something there. There's something there that's not, that you can't put your finger on. And it makes a big difference.
Thank you. To finish up the question about the funding, I do know that for the CLEC and IBCLC programs at UCSD, the San Diego County Breastfeeding Coalition has partnered with them to provide some scholarships, and you will be able to find that information on our new website. It's still launching. We launched it just this month, and we will be adding information on the rest of the pages, but there is some information now, including a blog post by our board member, Charday Fontenot, who has written about increasing the number of Black IBCLCs. You can check that out on our website now. Kind of to that last point that you mentioned, Jara, we do have a question from somebody that says, I am an LC in a hospital setting. What are some questions or talking points that you feel are important to ask Black mothers that can help them feel more seen? Anyone on the panel?
I think having, like, talking a little bit about what their expectations are, asking, you know, how you can support them. Another thing I think that we could do is have a understand like a referral out. So I think, and this kind of cycling back to what I just finished on, is that, you know, is there anybody that looks like them as part of their healthcare team? You know, can we have somebody come and just chat with this person, or outpatient? Can we give them some resources that where they are going to have, you know, a provider that you know looks like them, and then specifically, I think that just being, you know, present and open. I think that goes a long way, and I would love to see if we could just, you know, bring in some of these providers like myself, or some of the doula or postpartum doula support, and just say, hey, you know, maybe even mentioning, hey, you know, here's some resources of Black healthcare providers that you might, you know, look into if you need. And just having that you acknowledge that could be a huge opening to say, oh yeah, by the way, I had some other questions about breastfeeding, because now I know you see me, and I now know you were kind of where we are. So that those kind of things might just go a long way to have the normal conversations that you would have with any parent who's trying to breastfeed and initiate breastfeeding in the hospital. This
is Nancy White. I have a question about, isn't, Jara, what you're saying, having healthcare providers look like you, isn't that kind of a reverse bias? I'd rather train all races and all white or Hispanic or Latinx caretakers to be sensitive to the needs and the desires of the Black and other populations. But are we setting ourselves up to fail if we are talking about only having people that look like me as healthcare providers?
I don't think so. You know, that my direct experience, having never had a healthcare provider that looks like me, is no. And since this is Black Breastfeeding Week, I would like to hear from our Black professionals in the field and continue to focus the questions on what their recommendations are.
I think it's a both and, you know, I think that we have to do the work. Like, you know, if we ask the question, how do we close the gap? Well, we have to educate ourselves on the biases. We have to take some of the anti-racism training. We have to, you know, do the courses that Nikki's done to help the transgendered and non-binary folks. So we have to educate ourselves on the biases. But I think that this concept is, it doesn't have to be solely somebody that, you know, solely somebody that looks at you or has lived your experience. But having that brought in and having that presented as an option, I think we could do a lot better job there. And I don't think it's to exclude. I don't think that I would say, oh, I'm not going to go to this provider because they are not Black. I think that it's like the icing on the cake that everybody else gets to eat. I want to eat it too.
Thank you. That's an excellent answer, and I agree with you that, and with Maricela, that we do have to educate everyone, and we do have to listen to the people who have lived the experience, which is why I'm here and why we all on the San Diego County Breastfeeding Coalition board are taking bias training and uh, uh, other types of multi-training, because we do need to listen to you. Thank you.
Thank you. We do have just a couple of closing questions, and that is, since you have your own projects and you are really busy and focused on them, what have you seen that works best when an organization wants to partner and support you?
Cash. When an organization wants to support, and it really depends on what the organization is and how they want to support, right? The support is always welcomed. It matters not how or where it comes from most of the time. It just support for supporting these minority communities is always welcome. So, be a good ally. That's a really important piece. If you're going to step into this arena and, really want to kind of dress yourself in the coat of the ally, please remember that, most important step about being an ally is being able to be the person who lifts up the voice of the oppressed, that lifts up the voice of the minority, not someone who comes in and speaks for us as a minority. If you want to come in and be an ally and you want to volunteer as a doula at my birth center, that would be amazing. I would love to have you. If you want to come in as an ally and do your hours for your IBCLC or for your lactation education hours, and you want to come in and volunteer with people of color to do that, I welcome you to do that, but I also welcome you to understand the importance of allyship and what the nuances of that look like.
Thank you, Nikki. It's 10:58 and we don't have any other questions in the chat. If there's anybody else that's been holding on to a question, I invite you to type the question into the chat. Otherwise, I will invite our panelists to maybe share some closing thoughts before we wrap up the webinar. One last question for me, and then I think we'll be done. And that is, it is Black Breastfeeding Week. Can you tell us maybe a little bit of other observances that you've had or that you've participated in this year?
I'm going to be honest. I'm really bummed out that we're dealing with COVID right now.
Yes.
I was really looking forward to going to some breastfeeding support groups, just participating, being around other breastfeeding moms. I know that I think Black Infant Health and PCI, Mary, you'll have to tell me, but I think there was a brunch, but last year there was a brunch and it was great. So I've been here at my house breastfeeding my baby.
So you get Black Breastfeeding Week like intimately is what you're saying. It is happening at Jara's house.
Yeah, every 2 to 4 hours.
Black Breastfeeding Hour. Yeah, it's unfortunate that we're dealing with this pandemic situation because we haven't really been able to have the events that we would normally have and gather in the ways that we normally would. But I think that doing what we can virtually has been amazing, and as a healthcare provider, I'm still I'm fairly quarantined here in my house, as you can probably see by the piles of laundry behind me, but we're still able to get out in like little spurts here and there, and connect and assist people. And so, that's what I've been able to do. And I've been really happy about that. I just want to do more of it.
Thank you, Nikki. It's 11 o'clock. We're going to start closing up. But, Jara, you mentioned that you're home. And the blackbreastfeeding.org website has their international Black Baby Lift Up event scheduled virtually for today at 3 p.m. So that's one worth checking out virtually if you are interested in at least virtually being connected with other Black breastfeeding moms. Thank you so much for being on our panel today. It's good to see all of you. Thank you, everybody who has logged in and joined us. And I'm going to transition back over to Nancy.
Okay. Thank you so much. I apologize if my question offended anyone, but I'm asking questions and I'm learning from all of you, and it was wonderful to hear all of you speak. Thank you so much. And thank you all for our participants for attending our webinar. It is recorded and it's available at no cost to all of you. And of course, you'll get an email, and Maricela is wonderful at getting emails out with links to the evaluation form and how to receive your certificate of attendance, as well as your link to the recording. The certificate, I just realized that this is actually one eCERP, so that will be changed on the certificate of attendance. And we really appreciate all of our speakers. And thank you so much. We'll see you again hopefully next week when we have Dr. Lars Boda, Dr. Lisa Stellwagen, Dr. Christina Chambers, all from UCSD and UCSD Health, will be speaking on human milk and what UCSD is doing. Thank you so much for attending. We really appreciate your participation. Thank you.